The New Jersey Legislative Disability Caucus launched on December 1st, 2020, and in 2021 they held 4 roundtable discussions to examine critical issues facing the disability community. The Disability Caucus serves as a bipartisan forum within the New Jersey Legislature for lawmakers and their staff to consider the impact on the disability community when shaping all public policies, through increased awareness and a greater understanding of the complexities within the disability service system and issues affecting these individuals and their families. People with disabilities, their families, and organizations serve as resources to the caucus, providing education and programming as needed. With approximately 25% of adults in New Jersey identifying as having some type of disability, the caucus ensures their voice is heard in all decision-making processes. This is critically important as people with disabilities in New Jersey continue to seek opportunities to be included and represented in all aspects of life as an integral part of the fabric of our society. New Jersey is among just a handful of states that have formed a disability caucus within its state legislature. And in our inaugural year, New Jersey had 37 legislatures that joined to support and listen from these supporting agencies. These agencies provided disability advocates to speak on the issues at the roundtables that were held in 2021. Since the official launch of the Disability Caucus in December of 2020, the organization hit the ground running in 2021. With meetings starting in January through October. The topics covered issues like the impact of COVID, employment concerns, issues regarding housing and transportation. To learn more, please follow our YouTube channel and/or to view the full discussions. Before we begin our program, we wanted to show you some of the highlights from those discussions, starting with the official launch of the New Jersey Legislative Disability Caucus on December 1st, 2020.
Legislation that is going to have an impact on everyone in the state. We have to make sure that people with disabilities, that their views are put into the mix also. So having this caucus together, and I said this before, I'm grateful Tom Kane and I worked on many issues in the Senate, and the legislators on this call, I know all have a great level of care and compassion, and this is something we should have been done a long time ago. I'm glad we're finally here, that we're going to ensure that people with disabilities' voices are heard, as we just recently did with NJ Transit.
The impact on healthcare and the disparity of residents with disabilities and how it might affect their healthcare, see them with a higher level of health costs and needs that maybe go unhidden or unnoticed until the time of the budget.
We talk about equality. We talk about pandemic. We talk about health. We talked about social justice. We talked about vaccine importance. So as we move forward with this caucus, we cannot forget our folks who are there to contribute the same things that we are searching for, and that is equality. They need to be put on the same playing field that we are. They have families to support. They want to live independently. They don't take handouts, and they want to make sure that they are an equal partner in everything we do in the legislature.
One who grew up in a family with a family member with a developmental disability, I understand firsthand how hard it is, not only for the disabled, but for the family members, and how they struggle to make sure that their voice is heard, and how they worry what the future will bring for their loved ones.
Because we know tearing down barriers and creating accommodations is not about something that's nice to have. This is about making sure that we honor the civil rights of all of New Jersey's residents with disabilities.
The issue of mental health is always important. We've spoken about I've struggled with depression for years. It's a really important issue to me. And that is something I know that Assemblywoman Women Hub and many others have championed, the Senate President, that we need to make sure that those with disabilities, the mental health challenges that they face, that collectively it's not on the back burner. And I know that with this caucus in the months and years ahead, there are going to be so many issues that we can make sure that those who are the most vulnerable here in New Jersey are not left behind.
I think about early intervention and the importance of it. It's not only important for able children, it's so important for the disabled child. So to determine early on whether or not, the diagnosis of autism or ADHD or severe learning disability, comprehension disability, there's so many educational components. The earliest the intervention can happen, the better the result can be for children. Education is, equity, all students is imperative. We need to remove barriers. I think I've heard this several times, but we need to remove the barriers so that our children can be successful. It is really the mission of this caucus that everything we do, whether or not it's transportation, whether or not it's education, whether or not it's human services, or whether or not it's finance, insurance, and banking, we're constantly thinking about our disabled community.
Every person with a disability is unique, and their needs are unique. And we have to remember that. It's not one size fits all. This especially became clear during COVID. All of the issues everyone talked about, whether it be transportation, education, food, housing, all of those different issues, healthcare. But is not, again, limited to one group, because we have intellectual disabilities, we have developmental disabilities, we have physical disabilities, we have multi-disabilities, people who suffer from dual diagnosis, so they have mental health issues together with another disability, those who have many, 3 or 4. That's, again, why it's so hard to really have one size fits all. And for that, we need to remember to include the parents, to include the caregivers, the guardians, because they know best too, as well as the rest of these wonderful people at these organizations.
On January 26 of 2021, the Disability Caucus Chair, Senate President Steve Sweeney, the Legislative Caucus members, and advocates from the disability community met for the inaugural meeting of the caucus to discuss the impact of COVID-19 on people with disabilities. With the COVID-19 pandemic taking a disproportionate toll on people with disabilities, the topic led to a robust discussion among policymakers and advocates for this first briefing session of 2021.
The impact on healthcare and the disparity of residents with disabilities and how it might affect their healthcare, see them with a higher level of health cost and needs that maybe go unhidden or unnoticed until the time of the budget.
Despite all of the work that has been done, COVID-19 has showed us how much more work is left to do. And together we have to continue to work with all of you. We've heard about many of the services and issues that are needed for everyone today, but there's no question that one of the most pressing issues facing the disability community is access to mental health services. And COVID-19, as you heard, and as we all know, has taken a toll on everyone's mental health. However, access for the disability community can look very different and pose many different obstacles than what the non-disabled community experiences. COVID-19 has left all of us feeling isolated and lonely. However, for individuals with disabilities living in group homes, that isolation has been all the more extreme.
On April 27th of 2021, the Legislative Disability Caucus convened to discuss employment issues relating to barriers, successes, and future directions.
And as we start talking about employment and we start talking about the value of having folks with disabilities work with us and actually contribute to the way we see things is such a pleasure.
On July 27th of 2021, the Legislative Disability Caucus met to discuss issues relating to housing.
You pointed out S 1676 has now been signed by Governor Murphy. It is the law of our state. And what it does is to allow hospitals permissively, they're not mandated, but they are permitted to get into the housing business, the housing healthcare business. As was pointed out in Mercedes' opening remarks, housing for the disabled community, for the homeless community has huge impacts on healthcare outcomes. It also applies for the disabled community. This, especially as you said, the goal was to get 100 deed-restricted Medicaid beds. Let's get thousands. Forget hundreds. Let's go for the gold.
If there's one thing that we know, it's that the demand has and still does far exceed the supply for group homes, especially here in my district in Morris County, where the housing stock is so expensive. We can certainly do better around the state. I want to commend my colleague and next speaker, Senator Singleton, for his recent legislation that would free up to $20 million for the Special Needs Housing Trust Fund in the Housing and Mortgage Finance Agency, increasing funding for these projects to design the house and help individuals with special needs is essential for accomplishing the goals that we share. Just last week, I had the good fortune to sit down and meet with Morris County Housing Alliance. And the demographics show that in Morris County, nearly 50% of our homeless population suffer from some form of disability or mental health issue. So, we need to be able to fund these projects, and we need to make them affordable.
Since joining the legislature, it's been part of my mission to really think through and try and work to secure an access for housing for every resident. And it becomes especially important for our residents who deal with disabilities through the special needs housing. The focus of this new law, quite frankly, is to buttress the Special Needs Housing Trust Fund. Now, this trust fund was established in 2006 by the New Jersey Economic Development Authority. Unfortunately, we came to realize that the fund has since been depleted, despite its critical role in supporting housing projects for some of our state's most vulnerable populations. When learning about the depletion of the funding, it became critical for legislative intervention to find a source of funding for this important initiative. And I'm proud that this law was passed unanimously by all members who voted in the Senate and the General Assembly. This new bipartisan law, was stated, transfers $20 million from the Affordable Housing Trust Fund to the Special Needs Housing Trust Fund.
On October 26 of 2021, the issues relating to transportation were discussed at the caucus roundtable.
Just last week, I met with an organization, and there were over 100 people on that call, just sharing appalling stories of what they personally experienced. And really, what it comes down to is one word, and it's stranded. People have been stranded.
Transportation access is key too. I'm proud as transportation to work with my colleagues and to join this caucus so that we have a fight for transportation equity. We know that disability doesn't take a day off. Disability doesn't take a holiday. So transportation equity and equity in all that we do is so important day in and day out in our policies. It has to be baked in.
In this first year, we've actually accomplished a few things, I think, that are meaningful. By no means are we finished. We have a long way to go, but this caucus, I am thrilled with the bipartisan nature of my colleagues that are on this, that we put the disabled community first, and we're just figuring out how we can do things better. Because one thing we did know is don't work. System does not work.
To learn more about the New Jersey Legislative Disability Caucus, please visit our website.